or the objective of this topic is when we start examining a child with fever, how to take history, how to do physical examination, and how to order investigation. So this is a very, very important topic because fever is the #1 complaint from the parent. Because of fever, the children were brought to the hospital, okay, as the most common cause. Now see this, let's introduce the topic. Fever is most common presenting complaint in pediatric age group. There is no doubt about it. Parents, they cannot stay at home if their baby is having fever. Even if it is the middle of the night, they'll run towards the hospital. It is also the commonest parental concern in a child. And this is very true, isn't it? Even a slight rise in temperature in their child makes the parents very concerned. They want to find the cause. They want to decrease that temperature anyhow. And among the children, majority of them presenting with fever are less than 3-year-old. So they are quite young children. And in those young children, if we fail to diagnose bacterial infection, which is causing fever in time, they can quickly develop septicemia, and there is high chance of death as well. That's why do not ignore a case of fever. Just try to diagnose, try to find out what is the cause. And viral fevers, are less risky, but bacterial infection which leads to fever are, we should take them a bit seriously. Now let's talk about what is the definition of fever. See here, fever is a controlled increase in body temperature over the normal values for an individual. So control increase in body temperature over the normal values for an individual. Very easy definition. It's a controlled increase in body temperature. It is not uncontrolled one. If it is uncontrolled type of body temperature rise, we call it hyperpyrexia or heat stroke, and the different terms are there. The practical definition of fever is when the rectal temperature is more than 38 degrees centigrade, or in the Fahrenheit scale, it is more than 100.4 degree Fahrenheit. You just remember this, okay? This is a very, very important point. More than 38 degree or more than 100.4 degree Fahrenheit is called fever. But practically, how we measure the temperature? Yes? What is the most common way of measuring temperature these days?
Thermometer.
But where you put the thermometer? Where?
Mouth, axilla.
Sir, these days infrared thermometers are used.
Good. So different answers are there. Very good. Okay, I'm quite impressed. So thermometers are kept in different areas. One is oral cavity, below the tongue or in the mouth. Second, in the armpit or axilla. And third, in the groin fold. In very small babies, we can put in the groin fold as well. And another is a rectum, the rectal thermometer. Okay, we put inside the rectum. But rectal thermometer has some of the complication associated with it. If we push a little bit deeper, then it may perforate the rectum. The cases have been reported. So don't try to take the rectal temperature. Okay, rather axillary or armpit temperature is the most commonly used if you use the ordinary thermometer. But if you have electronic thermometer, just showing that electronic thermometer in front of the child will give you the temperature. These days, this is a time of COVID infection all over the world, and everybody know that wherever you go, they just take the temperature with that electronic one these days. Exactly like that, we can also use them in our patient, also in the pediatric age group. Okay, so these are the different way. Now, fever is induced by pyrogens. The pyrogens means these are the factor which leads to rise in body temperature. They are roughly divided into two types: endogenous pyrogen and exogenous pyrogen. Endogenous pyrogen means they are the cytokine, like prostaglandins, like leukotrienes, okay, like interleukin 1 and other types of interleukins. They are called endogenous pyrogen. Whereas exogenous pyrogens are different type of allergen, different type of antigen, different types of pathogen which enter into the body from outside. Now, before we go on to the discussion of pathogenesis of fever, okay, all of you please focus on this slide. This is the temperature range in centigrade and Fahrenheit, and this is the oral temperature, okay, oral. So the normal range is 36.6 to 37.2 degrees centigrade, and this is in a Fahrenheit scale. You have to remember either one of them. Both are not necessary. Subnormal when it is less than 98. Febrile, okay, see there. Now, if we take the temperature from rectal route, it is 100.4 degree Fahrenheit. But if we take it from the oral route, more than 99 is diagnostic of fever. So this is a small practical point for you. Regarding hypothermia, less than 95 degree Fahrenheit is hypothermia, or less than 35 degree centigrade is hypothermia, means decreased body temperature. And hyperpyrexia is a very high temperature in the body, more than 107 degree Fahrenheit. This is a lethal condition. Patient may die because of hyperpyrexia. Now, there is one important point which is known as diurnal variation. Our body temperature in the evening is 0.5 degree centigrade more than the morning because of increased metabolic rate. And if you want to convert the degree centigrade into degree Fahrenheit, this is the formula. Okay, this is the formula. So this is the formula you can use to convert it. So multiply that degree centigrade by 1.8 and you add 32 in that, and that degree centigrade will be converted into Fahrenheit. Okay, but this is not a very important point. Nobody is going to ask you about that. Now, let's talk about what is the pathogenesis of fever. Absolutely important concept, and I hope you have done this during your physiology lecture. Okay, have you? Was it taught before or not in physiology? Yes?
It was taught.
Yes.
Yes, sir, it was taught.
No problem. Even if it was not taught to you, everything cannot be taught in the class. Okay, I have that type of concept. Actually, everything cannot be taught by the teacher. But if your teacher says this is important, students have to follow some of the textbook and then try to learn. But we want to cover those important points as far as possible. Now, please pay attention here. Whenever somebody is having infection, viral infection, bacterial infection, fungal infection, or any severe type of parasitic infection, if we are having inflammation like allergic manifestation, like connective tissue disorders, if there is an effect of toxins in the body, toxins are again released by the different bacteria. And if there are some immunological response, like hypersensitivity reaction, for example, all of these will activate our immune system, and the inflammatory cells will come into the picture, like neutrophils, macrophages, lymphocytes. Okay, different, even endothelium is a part there. Okay, endothelium is not directly associated, but after the activation of endothelium, the platelets would come into the picture, and platelets would release some of the activating factor, and they are also a type of cytokines. So all these things are happening inside the body. Now what will happen? Different cytokines would be released. These cytokines are known as endogenous pyrogen. They act on the hypothalamus, and hypothalamus is the center which regulates our body temperature. inside the hypothalamus, there is synthesis of prostaglandin. Prostaglandin E2 is the main one. Along with prostaglandin, even leukotrienes are synthesized, but prostaglandins are the main substance here. Now, what that prostaglandin would do, they will elevate the thermostat. Okay, they will elevate the thermostat present inside the hypothalamus. This thermostat is the temperature regulation center. So the body believe that temperature has to be raised, okay, to maintain the temperature in the body. So what will happen? Because of different mechanism, the overall body temperature will be high. One of that mechanism is stimulation of the vasomotor center, leading to sympathetic chain stimulation or sympathetic nervous system stimulation. You can say sympathetic nervous system stimulation leads to vasoconstriction, which will conserve the heat in the body. Remember, vasodilation will lose the heat, and vasoconstriction, the heat would be conserved, or heat cannot be lost outside, which leads to increased body temperature. This is one mechanism. Another one, okay, from the hypothalamus, the different input will be given to the peripheral organs, to the muscles as well. So there is muscle contraction. You have heard about the term called rigor. This rigor is the muscle contraction. Okay, so what happens? There is excessive heat production, and that will further help in the increase of body temperature. And one more point you need to understand here, because of this, okay, the person will make some behavioral changes, because there will be input to the cortex also, cerebral cortex, frontal lobe, okay, and other part of the brain. So the person will have behavioral changes. If the person feels a little bit cold, the person will put on more cloth. The person will probably close the door and the windows. And if the person is feeling excessively hot, the person will open those things. Person will remove the cloth. This is known as behavioral change, because of the different mechanism which is happening inside the hypothalamus. Now let me summarize, okay, this important pathogenesis in few sentences. There are two types of pyrogen, endogenous and exogenous. Exogenous pyrogens means different type of infection and inflammation. Endogenous pyrogens means cytokine. Both of these would cause increased production of prostaglandin in the hypothalamus. Prostaglandin will elevate the thermostat, and then different mechanism will occur in the body. One is vasoconstriction, which will cause conservation of the heat. Another is, because of the muscle contraction, there is excessive production of the heat. Both of them will lead to rise in body temperature, that is called fever. At the same time, because of the cortical input, there are some behavioral changes also happening in the patient. Let's move on. Now, after this, let's talk about what are the types of fever. Now here, one type is called continuous or sustained fever. Continuous or the sustained type. Continuous is a more common term, and here the temperature is persistent and doesn't vary by more than 1 degree centigrade in 24 hours, and it doesn't touch the baseline. So what does that mean? There is no fluctuation more than 1 degree centigrade, and it never touches the baseline or the normal. This is called continuous type of fever. And the common causes are enteric fever or typhoid fever, different types of pneumonias, brucellosis, urinary tract infection, and so many other examples you can give here. Okay. Now, second type is called remittent fever. Now, what's the meaning? In this, the fever is persistent and it varies by more than 1 degree centigrade in 24 hours. Means wide fluctuation of the fever. And there is no fever free period. Remember that? Fever is, there all the time, but wide fluctuation. Sometimes patient may be having 40 degrees centigrade. Sometimes patient may having 38.5 degrees centigrade. So there is clear-cut fluctuation by more than 1 degree centigrade, but it never comes back to 37 degree until and unless we treat for the cause. And some of the causes are infective endocarditis, especially the acute type of endocarditis, which is caused by Staph aureus, sinusitis, and even rheumatic fever. These are the causes of remittent fever. Let's move on. What is intermittent fever then? Intermittent fever. Now see here, when fever is present only for few hours during the day, and in between there is fever-free period. And patient is all right, there is no rise in body temperature in between the febrile period. This is known as intermittent fever. And again, this intermittent fever is of different types, like quotidian fever, torsion fever, and quartan fever. These are very important terms and routinely asked in the exam, especially in MCQ. Quotidian fever, torsion fever, and quartan fever. Now, one of the commonest cause of intermittent fever is malaria. Now, see that the different causative agent of malaria, like Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae, and these days even Plasmodium knowlesi. Okay, that's a new type of pathogen. Now, quotidian fever is fever occurring every day, typical of Plasmodium falciparum. Torsion is fever occurring in the alternate day, and quartan is fever occurring after every 2 days. So these are the common causes. Apart from malaria, if there is abscess formation inside our body, that can also result in intermittent type of fever. Okay. Let's move on. Now see here. So again, that point is coming back. What do you mean by chills and rigor? You can answer this. What is fever with chills and rigor? Anyone?
Feeling cold with muscle contractions.
Excellent, Bakir. Very good. Chills means feeling cold. Rigor means is shivering. Feeling cold is chill. Shivering is rigor. So there are so many, diseases or causes of fever where chills and rigor is quite common. So let me write some more causes here. Apart from UTI, okay, the type of UTI which leads to fever with chills and rigor is called pyelonephritis. See here, pyelonephritis. Another is lobar pneumonia. Lobar pneumonia. Another is called cholangitis. Okay, cholangitis, and even abscesses in different parts of the body. Now, what is pyelonephritis? What is pyelonephritis? Yes.
So basically, cell is inflammation of the inflammation sir, in the kidney are caused by cell bacteria, sir, mainly like cell Klebsiella, Enterobacter, Escherichia coli.
Absolutely, very good answer. Good. This is the infection of renal parenchyma. Infection of renal parenchyma. This is considered a part of upper UTI, a very severe type of infection, and it is mainly caused by E. coli and other Enterobacteriaceae family. E. coli and other Enterobacteriaceae family. Lobar pneumonia is caused by pneumococci. Cholangitis is the inflammation of biliary duct. Okay, biliary channel or biliary duct infection is called cholangitis, and it is commonly associated with a type of jaundice which is known as obstructive jaundice, and different abscesses in the body like liver abscess, like lung abscess, retroperitoneal abscess, pelvic abscess, All of these can lead to fever with chills and rigor. Let's move on. If there is step ladder type of fever, means every day the fever is increasing and increasing. Now, for example, on day 1, just slight rise in body temperature, okay, 100.4 degree Fahrenheit, for example. On day 2, that temperature may be 101 degree. On day 3, maybe 102 degree, and day 4, maybe 103 degree. So gradually there is rise in body temperature. This is known as step ladder pattern, and this is usually seen in typhoid fever. Another important term is called pale abstain fever. This pale abstain fever is the hallmark of Hodgkin's lymphoma, and in this fever there is febrile period for 1 week and afebrile period for next week, and again the febrile period will come back. So it is the alternate week of febrile period and afebrile period. This is Pearl Epstein's fever. This is a very important question which can be asked in the exam. Try to remember this, okay? And Hodgkin's lymphoma is a type of lymphoma. Lymphoma are the malignant tumor which arises from the lymphatic tissue. Now we are moving on to the very common, or important part of this lecture. What are the common causes of fever of short duration? That means fever present for less than 2 weeks duration are called short duration. So what are the common causes? Respiratory infection is a common cause of fever in children. Among them, upper respiratory tract infection is a very common cause of fever, like common cold or flu, pharyngitis and tonsillitis, as well as pneumonia. Pneumonia is lower respiratory tract infection, whereas common cold and pharyngitis as well as tonsillitis are known as upper respiratory tract infection. Very, very common in children. Other are viral fever. Many different viruses are included here on the list. This is never complete list, okay? You can always add few more there. Influenza virus, which causes flu, okay? The flu is a very commonly used term even by the public. So you must have heard about it. This is caused by influenza virus. Now many of the students are commonly confused this term for Haemophilus influenza. Now please remember, Haemophilus influenza is not written as influenza. Okay, we write that definitely as H influenza or HIV. That is altogether very different term. That's a type of bacteria, and bacterial infections are always more complicated than the viral one. This influenza is a flu caused by influenza virus. Now another types of viruses which can lead to fever of short durations are hepatitis, especially hepatitis A virus. Okay, but hepatitis A virus can be there for a relatively longer duration also. Measles, common infection in the children, but these days because of the vaccination, measles are not that commonly seen as like in the past. But still, because of the lack of vaccination in some of the areas, certain outbreak of the measles cases still occur. Now, what is herpangina? What is
They are called mouth blisters. There is a mouth infection caused by Coxsackie virus.
Good. Very good answer. Herpangina is the infection of the posterior part of the oral cavity, which is caused by Coxsackie virus, especially Coxsackie A virus. This is called herpangina. Now don't get confused because a herp term is there and many of the students believe this is caused by herpes virus. This is a wrong concept. Herpangina is caused by Coxsackie A virus. Very painful condition for that kid because it causes some vesicle or ulcer formation on the posterior part of the oral cavity around the tonsil area. High grade fever will be there. Urinary tract infection, mainly pyelonephritis, okay, is another cause of fever of short duration. The lower urinary tract infections like cystitis and urethritis usually doesn't cause fever. Malaria and Kala Azar can also be included here in the list. They are type of chronic infection also, because if we do not treat them in time, they will develop into chronicity. And meningitis, bacterial meningitis and viral meningitis are some other causes of fever of short duration. Among them, the most important point for you is a respiratory infection, very, very common in children. Now, let's talk about what are the causes of fever with rash formation. Now, rash means any spot on the skin. That spot can be red, that spot can be of different other color. Okay, usually they are red. Sometimes they are a bit of discolored area. Sometimes they are slightly elevated from the skin, and sometimes they are of fluid filled lesion also. So all of these are called rashes. Now I want everybody to focus on the this right hand side of the screen. So let me show you now. See this. These are the diseases which are causing fever with rash: rubella, chickenpox, meningococcal septicemia, scarlet fever, exanthum subitum, infectious mononucleosis, measles, and erythema infectiosum. Now, some of those terms are quite familiar to you and some are new. Okay, so let me explain all these things one after other. Rubella is caused by rubella virus. Rubella virus, okay, causes the disease known as rubella. The types of rashes here are macular rash. Now, what do we mean by macules? These macules are discolored area on the skin. Okay, remember this? They are the discoloration on the skin. The size of macules are very small. They are less than 5 mm in size, and they are neither depressed nor elevated from the skin. We cannot feel them. We can just see them. These are called macules. So the rashes appear on the first day of the illness, and it starts from the face and gradually goes downwards. Rubella is not a very severe infection in children. But if a pregnant lady develops rubella in the first trimester, what will happen to the baby? Yes? What will happen to the baby? Exactly, it leads to congenital rubella syndrome. This is a very severe type of problem, okay? Congenital rubella syndrome. The baby may become blind, the baby may become deaf. There is hepatosplenomegaly with a lot of rashes on the body. The baby may suffer from congenital heart disease as well. And we have got vaccination against rubella. Which vaccine? Which vaccine we give against rubella? Which vaccine works against rubella? Anybody?
Sir, MMR vaccine, sir.
Exactly, you're right. This is MMR vaccine. MMR, measles, mumps, rubella vaccine. Okay, so I'm providing a little bit more information here, so that would be helpful for you later on. See there? Now another type of infection, okay, which cause fever with rash is chickenpox. It is a very common infection in pediatric age group. The type of rashes produced by chickenpox is maculo-papulo-vesicular rash. Now, all three different types of rashes are there. Macule, I've just explained you the meaning. Papule means a slightly elevated area on the skin, and the size is still less than 5 mm or millimeter, and we can feel them. You can also call them small nodule, which are less than 5 millimeter in size. Whereas vesicle means fluid filled blisters, and the size is again less than 5 mm. So combination of macule, papule, vesicle, and pustule. There is one more term which is called pustule. Pustule means pus present inside the vesicle, that is pustule. If everything occurs together, almost we get the diagnosis of chickenpox, and it is a very common disease. So rashes occur in the first day of illness, and it may start from any body part, especially on the trunk and on the face. Later on, it may also extend to the limbs. Now, what is the causative agent of chickenpox? What is the causative agent of chickenpox? Anybody? Which virus causes chickenpox?
Sir, varicella zoster virus. Sir, I'm not sure, but I think varicella zoster virus.
You're absolutely correct. It's varicella zoster virus. Okay, this is varicella zoster virus. You should have studied this in microbiology. Okay, varicella zoster virus. Let me write it here. VZV, varicella zoster virus, is the causative agent. This chickenpox is also considered not a very severe infection. The child will recover on its own, especially if the child is not immunocompromised. And we have got a drug against varicella zoster virus because it belongs to herpes virus family, and that drug is acyclovir. Acyclovir can be used in case of certain indication. The third important disease which cause fever with rash is meningococcal septicemia, and of course it is caused by meningococci or Neisseria meningitidis. This is the type of bacteria. It leads to hemorrhagic rash, okay, hemorrhagic and necrotic rash to be very precise. The rash occurs on the first day of illness, and it may appear from any body part. This is a very lethal type of infection because within 24 hours, if we fail to diagnose meningococcal septicemia, the baby may die because of septic shock and Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome, where there is bilateral hemorrhagic necrosis of the adrenal gland. So I was talking about the different causes of fever with rash in children. This is a very important question from the exam point of view. I was explaining about meningococcal septicemia as the cause of fever with rash. The types of rashes here are hemorrhagic and necrotic. This is a very serious disease. In 24-hour duration, if we fail to diagnose, we may lose that baby because of septic shock. And one of the very important complications occurs in the adrenal gland is called Waterhouse-Friderichsen syndrome. I'm sure many students know this term already. That is bilateral hemorrhagic infarction of the adrenal gland. Now what happens if adrenal gland is necrosed bilaterally? What are the hormones coming out from the adrenal gland? Yes, which hormones? Anyone?
Sir, with progesterone, aldosterone, sir, the DHEA, sir, and the corticoids mainly.
Yes, you're right. Okay, many students know that. This is a very common question which we ask in the exam. See that, though it is not related with the case of infection here, but still, this is the way your teacher love to associate the things. Because of Waterhouse-Friderichsen syndrome, there is bilateral necrosis of the adrenal gland. So mineralocorticoid, glucocorticoid, and sex steroid, they are deficient, and we need mineralocorticoid and glucocorticoid for the survival. Okay, so that's why it has a very high chance of death. Scarlet fever is another cause of fever with rash. Scarlet fever. Now, what is the causative organism of scarlet fever? Yes?
Streptococcus pyogenes, sir. Streptococcus pyogenes.
Streptococcus pyogenes, sir.
Good. It's Streptococcus pyogenes, and What is the another name for Streptococcus pyogenes? What is another name? Anybody? We want to know the another name also, because sometimes that name is used for the question. Group A, beta hemolytic streptococci. Group A, beta hemolytic streptococci. Now see that this is the full form, or another term I should say, of Streptococcus pyogenes. Now let me talk a little bit about scarlet fever. Please pay attention. I'm giving a bit of more information here. Scarlet fever, the type of rashes here are mainly papular type of rash. They are known as sandpaper type of rashes. When we palpate the skin of the child, we can feel those rashes very prominently. Okay. At the same time, if we examine the tongue of that child, it looks like a strawberry. So strawberry tongue and sandpaper-like appearance. These two are important feature of scarlet fever. Never forget this. So the rashes usually appear on the second day of illness, and the site of first appearance of these rashes are in the axilla and in the groin. Later on, they can spread to the whole body. Another type of infection, okay, see there, which causes fever with rash, is exanthum subitum. Exanthum subitum. Now, what is the meaning of exanthum first? We should know that. Exanthum means rashes present on the outer surface of the body. Enanthum are the rashes which are present on the mucosa of the body, means on the inner surface of the body. Enanthum and exanthum. Exanthum outside, enanthum inside. Now, right now we are talking about exanthum subitum. So this is caused by which viruses? Anybody know which viruses?
So the human herpes virus 6 and human herpes virus 7.
Exactly, human herpes virus 6 and 7, HHV 6 and 7. Okay, 7. These are the member of herpes viridae family. HHV 6 and 7. They cause a disease known as exanthum subitum, and another term for exanthum subitum is called rogeola infantum. Okay, rogeola infantum. This is another term. Rogeola infantum. Now, this exanthum subitum is a very minor type of infection in that child. Okay, very young children are affected by this, and there is a rash, fever, mild fever with rashes, and fever usually lasts for around 3 to 4 days, and after that the rashes will appear, and after rashes appear there is disappearance of the fever, and fever rash also lasts for around 3 to 5 days. So this is exanthum subitum. So maculopapular rashes are there. On the third day of illness the rash appear and the site is usually trunk. Now, another infection which causes fever with rash is called infectious mononucleosis. What is the causative agent?
Sir, Epstein-Barr virus. Epstein-Barr virus.
Exactly. This is caused by Epstein-Barr virus, or EBV, Epstein-Barr virus. So this is an acute manifestation of Epstein-Barr virus infection. It is a maculopapular type of rash. Let me repeat again. Macule means just a simple discoloration on the skin which are less than 5 millimeter in size, and papule are palpable lesions still lesser than 5 millimeter in size, but we can feel them. The common time for the appearance is from 4th to 6th day of the disease, and site of appearance is from the trunk or the upper arm. This infectious mononucleosis commonly causes tonsillitis as well. Tonsillitis. Okay, so there is a painful throat in this condition. It is also associated with hepatosplenomegaly. And one very important point, if by mistake or by chance, if we feel this tonsillitis is caused by group A beta hemolytic streptococci, we may give ampicillin for the treatment. And use of ampicillin will cause rash formation in case of infectious mononucleosis. Never forget this. Use of ampicillin may lead to rashes in case of infectious mononucleosis, and it is caused by Epstein-Barr virus. Another important viral infection which causes rashes is called measles. In measles, there is maculopapular rash. It is caused by measles virus. And another term for measles is known as rubeola. Rubeola is called measles. It's not rubella, it's rubeola. Okay, so here also the maculopapular rashes will be present, and it is present on the 4th day of the illness, and it mainly appears from the face and then rapidly spread downward. Now let me talk something about this, because this is a very important question in the exam. In the beginning, there is fever in the child. Along with fever, the child has runny nose, moist eye, okay, and a bit of sore throat. And by 4th day, the rashes appear, and after rashes appear, the fever will even increase. The fever will further increase. The fever will become high grade after the appearance of rash. This is a very typical history in case of measles. And these days, okay, measles cases are not that often seen because of the use of vaccination. We often give the measles vaccine at 9 months of age. Now, one more is called erythema infectiosum. Okay, erythema infectiosum, also known as fifth disease. Fifth disease. And this exanthum subitum is called 6th disease. Okay, 6th disease, and this is called 5th disease. Sometimes this type of question also can be asked in the exam. Now the causative agent of erythema infectiosum is which virus?
Sir, human parvovirus B19.
Human parvovirus B19.
Very good. You can simply say parvovirus B19. It is a type of DNA virus, and it leads to erythema infectiosum or 5th disease. In this condition, there is a very important clinical feature or very characteristic clinical feature. This is known as slapped cheek appearance. Okay, slapped cheek appearance. Now that child doesn't look very sick. Mild temperature may be there, and when you examine or look at the child, the cheeks are very red on both sides. It looks like a slapped cheek appearance. This is highly suggestive of erythema infectiosum or 5th disease. Now, one very important point here, probably we have studied this in hematology. If parvovirus B19 infection occur during hemolytic anemia case, it can lead to aplastic crisis. That is, it preferentially leads to infection of those very immature type of RBC cell in the bone marrow, and those RBC series would be destroyed, or they are very severely decreased for certain duration. This is known as aplastic crisis. The term aplastic crisis is a misnomer here. Actually, the other types of cells are not affected. Only RBC concentration will fall in case of parvovirus B19 infection when somebody is having hemolytic anemia. This is extra information regarding parvovirus B19. So these are the causes of fever with rashes. Very important question in the exam. So let's move on. Now, what are the common causes of prolonged fever? Prolonged fever means more than 2 weeks duration. See there. Infections or chronic infection like tuberculosis, diseases of hypersensitization. You can include different terms here like autoimmune disease and hypersensitivity reaction, like rheumatoid arthritis and SLE. Rheumatoid arthritis and SLE or other autoimmune disease. Some of the neoplasm like lymphoma, and leukemia can also have fever for prolonged duration. And you can easily include malaria and kala azar here in the infection heading, because those are the common chronic type of diseases. They can also lead to fever of less than 2 week duration, but if we do not treat them in time, the same illnesses can lead to prolonged fever also. Now, there is one very important term which is known as fever of unknown origin, FUO. In some of the textbook, it is mentioned like pyrexia of unknown origin, because fever and pyrexia are the same term. So don't get confused. FUO and PUO. If I use the term pyrexia, it will become PUO. Okay, so these are the same term. Now, what is the definition? This FUO is best reserved for the children with a fever, and that fever should be documented by a healthcare provider. That healthcare provider can be a doctor, can be a nurse, or can be other health worker. Okay, what does that mean? We don't believe if this type of history is given by the patient. Sometimes what the patient feel, they say, doctor, I am having fever inside the body, and when we ask the question, have you measured it, they say no, but I still feel I am having fever. That is not the way, you know. We don't trust that type of history. It should be documented, it should be measured. So that should be done by a healthcare provider for this definition. Very important part. And for which a cause could not be identified after 3 weeks of evaluation. And out of these 3 weeks of evaluation, 2 weeks as an outpatient, okay, and 1 week of evaluation in the hospital. So this is known as FUO. So let me make it easier for you. If a child is suffering from a chronic type of fever, okay, which is more than 2 to 3 weeks of duration, we have done extensive investigation for that. Still, the cause of fever is undiagnosed, and if that fever is measured by healthcare provider, means there is definite fever presence in the body. This is known as fever of unknown origin. Now, another question should immediately come in your mind. What is the cause of fever then in this situation? Okay. Now, where is the fault here? Where is the problem? Patient is having problem, but we healthcare person could not identify or could not diagnose that fever. So it is our fault. So what should we do? We should take good history again. We should go for the examination again from head to toe. We should revise all the investigation, what the patient has already done. And if necessary, we repeat some of the tests again and try to reach to the diagnosis. This is the meaning. Now, what are the common causes of fever of unknown origin? Now, if you analyze, okay, they are not the new things there. These are the common causes of fever in other children as well, like different types of bacterial infection. One of the common is tuberculosis, viral infection, rickettsial infection, and fungal infection. Rickettsia is a type of bacteria itself. It is known as atypical type of bacteria. Regarding the other causes, some malignancies, if they are present in the body, they can also lead to prolonged fever. Undiagnosed type of fever, like leukemia and lymphoma. Autoimmune disease, SLE and rheumatoid, arthritis or rheumatic fever, both. This is rheumatic fever, okay, RF. If I write RA, it will become rheumatoid arthritis. Both are autoimmune type of diseases. And then some granulomatous disorder like sarcoidosis and inflammatory bowel disease like Crohn's disease can also have mild rise in temperature, which we fail to diagnose in time. This is a common question which is asked in the exam for you. Now, one further question I can ask here: which investigation do you like to do then? Most of the tests were already done before. Remember, you have already investigated for outpatient and as an inpatient. So the point here is something is missing from our eyes. Something we have failed to identify there. So let's revise all the test again. And if necessary, let's repeat the test. And if we focus like that, then we can ultimately reach to the diagnosis. Let's move further. Now, the most important part of this particular topic is coming, that is approach. Now, what do you mean by approach in clinical medicine? Now, the meaning of approach is how to take history. Now, you are going to be clinician. How to diagnose the disease? We always start from the history taking, then physical examination, then necessary investigation. Then what we do? We take important point from the history, important point from physical exam, and important result from the investigation. We interpret it and ultimately reach to the diagnosis. This is known as approach. So if any examiner or any of your senior asks you, what do you mean by approach? What is the approach to a child with fever? This is the way you can answer. I start from the history and then move further. So history and physical exam should form the basis of provisional diagnosis in clinical practice. So if a child comes with fever, ask about the age of the child. We always ask this. This is a standard part of our history taking, the age. So some important points from the age are, if the child or the baby is less than 2 months of age, and if that baby is having fever, we should take that fever very seriously. There is a common statement here. We should take this as a evidence of serious bacterial infection until proven otherwise. What does that mean? Go for investigation. If CBC is normal, if the baby is not that sick, then I can be relieved. Maybe this is not a severe bacterial infection. But if the WBC count is already affected, if blood culture came positive, if there is some patch in the chest X-ray, if urine culture shows some bacteria, then this infection should be taken very seriously. Okay, that's the point. But after the age of 5, we don't need to be very serious regarding this type of fever. We can always watch for a few days because the age of the child is a little bit more. Second important question in the history is the duration of fever. Fever lasting for more than 4 to 7 days is rarely due to self-limiting viral illness and needs investigation after that. Now, what does that mean? Let's give some explanation here. Most of the upper respiratory tract infection like pharyngitis, like tonsillitis, any other types of viral infection, they usually do not last for more than 5 days. So as a pediatrician or as a clinician, I'll examine the child. If they do not have any severe other symptom, if their vital signs are within normal limit, if they do not look very sick, I can watch them till 4 to 5 days. Okay, just give some antipyretic agent and observe them. That is the meaning. But if the fever is lasting for more than 7 days, okay, there is high chance of some serious infection. So I will not observe anymore. I will investigate and then try to find the cause. If fever is lasting for more than 2 weeks, then of course this is never a very a minor causes of illness. This has to be some serious underlying problem. It needs thorough investigation and then try to reach to the diagnosis. This is the important point about duration of fever. Now let's move on. We already explained this point. Ask about fever with chills and rigor, whether it is there or not. Having said that, if chills and rigors are present along with fever, they may not pinpoint any important etiology. Okay, but some of the differential diagnoses are quickly thought of, like malaria, like pyelonephritis, like cholangitis, lobar pneumonia. These are few of the causes. Regarding the pattern of fever, okay, now what are the pattern of fever we talked about, or what are the types of fever we recently talked? Yes, who can answer?
Sir,
Anyone?
continuous sustained fever, remittent fever, intermittent fever, tertiary, quatern,
Good,
quotidian.
good answer. So just now, in the previous classes, we have talked about that continuous fever, remittent fever, and intermittent fever. Regarding intermittent fever, again different types like quotidian fever, torsion fever, and quartan fever. These are the different patterns. Now, one of the very important practical point here these days, nobody would go to hospital just like that. They always take antipyretic drug to decrease the fever. Nobody would just sit like that or stay like that, isn't it? So after we use antipyretic drug like paracetamol or ibuprofen, all these patterns of the fever will disappear. So even from the theoretical point of view, this is important, knowledge. But from the practical point of view, asking the different pattern of fever these days in clinical practice doesn't have a big implication, because the pattern of the fever is modified by the use of antipyretic drug. Another important point in the history is asks about the onset and progress of the fever. Now, how the fever started, that is called onset. Sudden onset or gradual onset, okay, that is the meaning of onset. And progress over the days. How is it? In the day 1, what was the degree of fever? In day 2, day 3, day 4, what is happening? Is the fever is getting more worse than before, or it's the same, or is it decrease? This is called progress. So we always ask this question. Now see here, bacterial fever worsens if left untreated, and malarial fever develops suddenly and declines swiftly. They are different, nature of the fever according to the cause. Now, another very, very important history we take are the accompanying symptom along with fever. Now, I want all of you to pay more attention here. These are the questions which will help us to reach the diagnosis. What is the cause of fever? Which organ is affected? Which system is affected? Okay, so these are the symptoms which will tell us. These are the symptoms which help in localizing the site of infection. Let's see this. If the patient say, or if the parents say, okay, if there is a very small baby, the baby cannot answer, so the parents will answer your questions or queries, isn't it? If the child is big, the child himself or herself can answer. So if there is cough, cold, or breathlessness along with fever, we all know the respiratory system is affected. So probably the infection is right there. So it is our job now to find out what type of infection. Is it URTI? URTI means, what is the full form?
Upper respiratory tract infection.
Exactly. This is a very commonly used short form in clinical practice. Okay, don't get confused. URTI, upper respiratory tract infection. It may be bronchitis, inflammation of the bronchus. Bronchus is a part of lower respiratory tract now. Pneumonia is inflammation of the lung parenchyma. Empyema, collection of pus in pleural cavity. Empyema. Otitis media, inflammation of middle ear. Lung abscess, and pharyngitis. Now, all of these are different disorders of the respiratory tract or respiratory system. So, fever with cough, cold, and breathlessness probably is because of any one of them. So this type of conclusion we reach after taking good history. Let's move on. Now see this, presence of diarrhea, vomiting, and abdominal pain in a child with fever shows there is a high chance of GI infection like hepatitis. The viral hepatitis is very common in children, especially hepatitis A. In hepatitis A, there is jaundice, there is abdominal pain because of swelling of the liver, and there may be a bit of diarrhea as well as vomiting. Amoebiasis is caused by Entamoeba histolytica. There is abdominal pain. Fever is not that important in case of amoebiasis though, okay? But sometimes fever can be seen because it's a type of infection. In severe type of amoebiasis, fever may be there. Rather than amoebiasis, in case of shigellosis or bacillary type of dysentery, fever is very common. Appendicitis is the inflammation of vermiform appendix, is a very important cause of abdominal pain in children, and there may be fever. But in appendicitis, fever is very low grade, and if high grade fever is there, that means appendix is already ruptured, and that ruptured appendix has already led to peritonitis. So this is a very serious condition now. Fever along with dysuria is a feature of UTI. What is dysuria? Dysuria means what?
Sir, pain during
Painful.
Exactly. Pain during urination or micturition. Painful urination or micturition is called dysuria. So naturally, it's one of the important feature of urinary tract infection. Both upper urinary tract infection and lower urinary tract infection will have dysuria. But in lower urinary tract infection, there is no fever. So if a patient or a child is having dysuria with fever, it means the child is having pyelonephritis. Another important question, whether there is drowsiness or convulsion along with projectile vomiting and fever or not. Now see this, if there is meningitis, encephalitis, brain abscess or cerebral malaria, these are the different types of intracranial infection. What is the problem the child is having now? There is fever naturally because all of these are infectious process. Along with fever, the child may be having vomiting, and this vomiting is a projectile vomiting because of raised ICP. ICP means intracranial pressure, which is high inside the cranial cavity. At the same time, the child may be having convulsion. Now, convulsion means it's a type of seizure. It's a motor type of seizure, okay? And the child may be drowsy or even in coma. So these features suggest us there is an involvement of central nervous system, and probably the cause of fever is there. Now, if there is jaundice along with fever, the most common cause is hepatitis. Inflammation of the liver is called hepatitis, and the most common cause of hepatitis in pediatric age group is hepatitis A. Okay, hepatitis A. Hepatitis B can be there, and other types of hepatitis like hepatitis C, hepatitis D, and hepatitis E can also be there. But hepatitis A is the commonest among all of them. Now, what is the route of entry of hepatitis A? How it goes into the body? Hepatitis A, anybody?
Blood transfusion, sir.
Blood transfusion, are you sure? Anybody?
Sir, a person-to-person contact, sir, from infected food, drinks, anything, sir, like that.
Okay. Now, see here, I am already giving clues to you. What I said just now, hepatitis A is the commonest type of hepatitis in children. So, it has to be transmitted by food and waterborne. Food and water. Contaminated food and water is responsible for hepatitis A infection, and that is so common in children. Hepatitis B, hepatitis C, and hepatitis D, okay, they are parenteral type of transmission. They are not food and waterborne type of illness. So probably some contaminated needles, some contaminated blood transfusion from mother to the baby, okay, from sexual contact. They are the different way of transmission of hepatitis B, hepatitis C, and hepatitis D. Hepatitis D always follows hepatitis B, okay, so we don't talk that separately. And hepatitis E is also water and foodborne illness. Now, presence of headache along with fever suggests there is a chance of meningitis, otitis media, and sinusitis. But let me clarify that further. Any cause of fever, any cause, if fever is relatively high grade, it will cause headache. We all have experienced that. Fever because of flu can lead to headache. Fever because of typhoid fever can lead to headache. Fever because of pyelonephritis can lead to headache. Fever because of osteomyelitis, any abscess, any type of high-grade fever can lead to headache. So this is a very non-specific feature. But if headache is severe one, then it may pinpoint towards the intracranial infection. Presence of skin rash with fever. What are the common causes? Like that the question will be asked, and just now we have talked about them. So you can confidently answer the same illnesses which are taught under the heading of fever with rashes, like chickenpox, rubella, meningococcal septicemia, exanthum subitum, erythema infectiosum, isn't it? Then Epstein-Barr virus infection and measles. So many different causes are there. Fever with joint swelling, very important history we are taking here. If there is joint pain and joint swelling along with fever, what does it signify? There may be some joint disorders like septic arthritis. Now, what do you mean by septic arthritis? Anybody?
Sir, septic arthritis, sir, it is caused by Staphylococcus aureus, sir, a bacteria, sir, basically it is caused by bacteria, that's why it is called like septic. And sir, arthritis is inflammation of the joint for of course, sir.
I agree with you. That's a good answer you have given. Septic means pus. Remember this term, sepsis means pus. There is a collection of pus inside the joint, and usually synovial joints are affected here, and the most common causative agent is Staphylococcus aureus. But other pus forming organisms can be the cause as well. Okay, septic arthritis, very serious disease of the joint. It may destroy the joint if we do not diagnose in time. Another cause of fever with joint swelling are connective tissue disorders like SLE, rheumatoid arthritis. All of them can lead to joint swelling. Even rheumatic fever can lead to fever with joint swelling or inflammation. So let's not forget about them. So this is pus collection. That's the meaning of septic arthritis. If there is lymphadenopathy along with fever, think about some acute as well as chronic infection like tuberculosis, toxoplasmosis, HIV, and other viral infections like Epstein-Barr virus infection as well, and even lymphoma and leukemia can lead to fever with lymphadenopathy. Lymphadenopathy means enlargement of the lymph node. Okay, very simple meaning. Now, what is toxoplasma? Which type of organism is this? Toxoplasma. Yes?
So Toxoplasma gondii, sir, we mainly call it.
Parasitic protozoan.
Very good.
Protozoa, sir, Toxoplasma gondii.
Very good. This is a type of protozoa. Excellent. Okay, that answer is enough. It's a type of protozoa. So it belongs to parasitology. We are coming to the end of today's class. So if there is fever with conjunctivitis, inflammation of conjunctiva or red eye, then these are the illnesses or disease we think of. There's so many others, okay, but the more important ones are highlighted here. Leptospirosis is caused by Leptospira, isn't it? Leptospira is a type of bacteria. It belongs to spirochete family. Measles, caused by measles virus, and Kawasaki disease, it is connective tissue disorder where conjunctivitis occurs. Let's move further. We're talking about the history of fever. Now, the contact history with similar disease is very, very important one. Sometimes multiple members in the same family are having similar illness, or sometimes, you know, the child may be in the daycare center and one of the child or a few of the child may be having that type of infection and our child is having that. So that contact with similar disease is very important point. Past history of similar illness. This is important one. This is just a heading of the history taking. We already discussed this. Recurrent viral infections are common in children, especially in the first year of school. There's no doubt about it, because their immunity is not that properly developed that time. So viral infections are very commonly transmitted. That's why I just told you, ask about the similar illness in the daycare center, in the nursery, in the school. Now see this, malaria may often recur as the therapy is merely suppressive. Now let me ask you, what are the causative agent of malaria? What are the causative agent?
Plasmodium falciparum.
Plasmodium malaria, Plasmodium venus.
Good. Okay, there are five species of Plasmodium there. 5 species of Plasmodium. Okay, so Plasmodium falciparum. Let me write that for you. Plasmodium falciparum is the malignant type of malaria. Then Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. Okay, and one is a very recent one, that is Plasmodium knowlesi. Plasmodium knowlesi. These are the different species. Now, one important point, in case of Plasmodium vivax and Plasmodium ovale, there is a hypnozoite form, a hypnozoite form inside the liver. That hypnozoite form may relapse later on. And the same thing has happened with so many of our students in Ichun University where they are studying. Now, they did not catch any malaria in China, but what happened? They were having malaria back in Pakistan, which was not properly treated. There was probably no drug called primaquine given to them, so that hypnozoite stage was not killed. It is still persisting inside the liver. So when they are in China, after a few years, the disease has just relapsed. So this is a very important question in case of malaria. Did you have malaria in the past or not? One question. Another one, which drug was given to you regarding the treatment? Let's move on. Okay. Now, another is a drug history. Which drugs are used in the treatment and what was the response to it? Very important question. These days, the parents take their child to the nearby hospital or nearby clinic, definitely, and they must have already given some treatment there. So what is the response of that treatment in that child? We have to ask that question. What drug was given? Was it antibiotic? Was it just antipyretic drug? Isn't it? So every information has to be noted. The interfebrile state helps in the evaluation of the probable cause of fever. Typically, fever due to bacterial infection respond to antibiotic in 2 to 3 days. Let me give you an example of pneumonia and typhoid fever. If it is caused by bacteria Okay, I'm talking about pneumonia now, like lobar pneumonia, which may be caused by pneumococci. By giving antibiotic, okay, now doesn't decrease the fever in the evening time. So it takes at least 48 hours, to 72 hours to decrease the fever. So we need to explain this point to the patient, otherwise they will be restless. What they think, okay, they think the drug should be a magic one. It should have a magic formula. After we give it to the child, the fever should disappear immediately. That doesn't happen. It always takes a bit of time. Okay, so as a doctor, it's my duty or my job to explain this point properly to the patient party. Typhoid fever takes even longer duration to normalize. So at least 3 to 4 days will be taken for typhoid fever to come down after we use proper antibiotic. So that's why proper drug history has to be taken, and we should ask what is the response of the drug regarding the fever. Now, another important history is immunization history. Okay, this is a special class for you, and I'm going to take this after I do this topic. Immunization or vaccination history is so important in case of a child. Okay, because we are talking about vaccine preventable disease in this era, and because of the vaccine or immunization, so many of the diseases are prevented. You can quickly give those examples here, okay, like diphtheria, whooping cough, and tetanus. We call it DPT vaccine. Even BCG vaccine, okay, polio vaccine, measles vaccine, mumps vaccine, rubella vaccine. So many examples are there. HIV, okay, that is Haemophilus influenza type B vaccine. So many vaccines are there. So we should ask a question, and how to ask the question, isn't it? Sometimes the mother may be illiterate. The mother may not know the name of those vaccines. So how to take the history? Very easy. You simply ask, did your child get all the vaccine according to the age or not? Did you go to the vaccination center when the doctor called you or not? And can you show me the record? Because every mother, every parents have that record of vaccination. You can quickly glance at that record and know which vaccines are missed or which vaccines are completed. And if the parents are well educated, they can easily answer this question. So this is about immunization history. Now, after completing the history, you have to make a historical diagnosis. Okay, many of the time you can make one or you can make few, but that may not be the final diagnosis. Okay, it should be supported by your physical examination. Now, what are the physical examination finding? Okay, we should check in case of a child with fever. The first thing is assess the seriousness. Assess the seriousness of the fever. See here, okay, just have a look here. How to assess the seriousness in a child? If these signs are present, okay, in a febrile child, then we believe this child is having serious underlying illness, and these are respiratory distress. Now let me ask you this question: what is respiratory distress? Anyone?
Simply difficulty in breathing.
Good. Yes, Bakir, very good. Any other? Any other student want to answer this?
Sir, one is also the acute respiratory distress syndrome, sir, but it's a completely another phenomenon. So in this case, sir, only like simply the baby cannot breathe.
Exactly, you're right. Okay, you're right. So let me explain this now. Respiratory distress means, you're absolutely correct. There is problem in breathing. There is problem in breathing. So we have a two component here. One is rate of the breathing. Okay, rate is rate, and another is how difficult it is. How difficult it is. Now these two are very different things. Regarding the rate, If you remember, I've already explained that to you. Till the age of 2 months, the upper, limit of the respiratory rate is 60 per minute. From 2 to 12 months, the upper limit is 50 per minute. And after that, till 5 years of age, the upper limit is 40 per minute. So if it exceeds that upper limit, this is tachypnea. It is one of the features of respiratory distress. That is about the rate. The second is how difficult it is. Now, to know the difficulty, we have to check certain signs. We'll talk about this so many times in the coming classes, okay? Don't worry about it. Like nasal flaring. Nasal flaring is one of the important sign which show the baby is having breathing difficulty. Another is intercostal and subcostal indrawing. Intercostal and subcostal indrawing means the chest is sucked inside when the baby is breathing. This shows there is, a very difficult type of breathing or respiration. Another important point is prominence of neck muscle. So which muscles are present in our neck? Which muscles? Which muscle I'm talking here?
Sternocleidomastoid, trapezius.
Exactly. Exactly. These are the two muscles which I want, okay? Sternocleidomastoid and trapezius. Here, okay? And trapezius. Another important feature is, grunting. There is some grunt sound which is produced by the child. So all these are important point regarding respiratory distress. You know this much now, but believe me, we'll repeat this so many times in the upcoming classes because this is a very important feature in a child. Respiratory illnesses are absolutely common in children. Let's move on. Another important feature which you love to check is the mental status of a child. The mental status of the child. Now see there. Regarding the mental status, we should check whether the child is drowsy or not, or whether the child is in coma or not. This is an important feature of mainly neurological problem like meningitis, encephalitis, brain abscess, cerebral malaria, sometimes even hypoglycemia can lead to drowsiness, which is very common in a child. Check for the meningeal signs. Now, anybody know what are the meningeal signs? Anyone?
Yes, sir. Sir, there are three
and
Zinky and neutral rigidity.
Okay, good, good. I can hear very clearly to all of you. So these are neck rigidity or nuchal rigidity. Nuchal or neck, it's the same term. Okay, the neck is very rigid. We cannot flex it properly. First thing. Second, Kernig sign, and third is Brudzinski sign. These are called signs of meningeal irritation. Okay, neck rigidity, Kernig sign, and Brudzinski sign. If they are present, then there is a high probability of meningitis and meningoencephalitis. Now, check whether there is a convulsion or not. Convulsion is a very serious feature. It is present in many different neurological conditions. Now we are talking about fever. So we talk about meningitis and meningoencephalitis or even encephalitis here. Check for the signs of impending shock. Now, signs of impending shock means upcoming shock. Till now, the child is not in complete shock, but the signs are almost there. That is the meaning. So tachycardia, okay, prolonged capillary refill time, isn't it? These are very important features. Drowsiness is another important feature of shock. Decreased urine output is another important feature. Low volume pulse may be another feature, but that is only present in hypovolemic shock and cardiogenic shock. In case of fever, the septic shock is very common to occur. So if we check the pulse may be bounding type. Bounding means high volume pulse, and periphery may be warm in case of septic shock. We have already done the topic of shock, so those are the important points you should never forget. Check for the purpuric spot. Purpura means, what is purpura?
Sir, they are purple color spots, sir, means from the skin hemorrhages, sir, or sir, from the internal capillary hemorrhages, sir.
Exactly. These are, okay, the signs of bleeding disorder. They are a small dot-like blood spot or a hemorrhagic spot on the skin. A small dot-like bleeding spot on the skin. These are called purpura. The smallest type of bleeding manifestation is called petechiae. These are pinhead size bleeding disorder. A bit bigger than that is called purpura. Okay. So if purpuric spots are there along with fever, then there is one very dreadful condition we suspect, and that is known as meningococcemia. Meningococcemia. But purpura without fever can occur in so many other bleeding disorders. Right now, remember, our topic is fever. So we correlate everything with the fever here. Severe pallor is another important, finding we must note. If a child is having severe pallor, then we take it very seriously. Severe anemia. And then abdominal guarding and rigidity. This is a feature of peritonitis. In peritonitis, the anterior abdominal wall is very rigid. Okay. Now there is a small difference between guarding and rigidity. Okay. Sometimes what happens when we feel there, there is a lot of pain. When we give a bit of compression or palpation to the abdominal wall, patient feels a lot of pain. So because of that, patient voluntarily contract the abdominal muscle. Now that type of phenomena is called guarding, and rigidity is because of involvement of parietal peritoneum. The overlying muscle is already contracted. So slight difference between them, guarding and rigidity, but both of them can lead to very stiff anterior abdominal wall, and these are the features of peritonitis. Let's move on. Now another is examine the general appearance, but we have already examined this. Remember that the slide which I just discussed, these are only the serious underlying feature. Okay, now let's talk a bit of general thing. During the general examination, if the child looks toxic or ill, toxic means very red looking face, high grade fever. Okay, from a distance we know this child is sick. This is called toxic appearance. It shows, it indicates there is a serious illness, most probably a bacterial infection. Irritability or discomfort may either be due to pain or respiratory distress, and a comfortable child indicates that a benign illness is likely. Now, when the parents brought their child to you, just closely observe the child. What is the movement? Is the child very restless or not? A child who is having pain in some part of the body is very restless. He may cry also. And if the child is having breathing difficulty, then also the child is irritable or restless. Whereas a comfortable child on the lap of the mother, or who is sitting nicely on the chair, okay, or on the bed, we believe a benign illness is likely. Probably the child is not that very serious. These are some of the very important points. Now let's check the vital sign. So we all know what are the different vital signs, isn't it? So let's list what are the vital signs first before we move further. What are the vital signs? Yes, what are they?
Temperature, pulse,
pulse oximetry,
respiratory rate,
Good,
respiratory rate,
very
and
good.
BP.
Blood pressure, respiratory rate, temperature, and pulse oximetry. Excellent. Though this is a very, very easy thing, but I often ask this question to my students so that they know it. They can answer immediately when this type of question is asked by the teacher. Remember, you have just began your clinical journey. From the 5th semester onward, you study the clinical medicine. That's why these knowledge are quite important. Okay, pulse or heart rate, blood pressure, respiratory rate, temperature, and pulse oximetry. Now, let's move on. Regarding the body temperature, in case of OPD patient, okay, outpatient department OPD, quickly judge the fever or temperature by merely touching the skin over the central and peripheral parts of the body. This is very commonly done. Okay, this is not very conclusive. We don't know what is the degree or grade of the fever, but we know whether the child is febrile or not. So how we do that? With the back of your hand, okay, back of your hand. Remember, not with the palm, with the back of the hand, you can simply touch the forehead of the child, or you can simply touch the hand of the child and judge whether there is increased temperature or not. And later on, you confirm this by taking the real temperature by thermometer. So where are the exact site where we put the thermometer? Now see this, the most common site is axilla or axillary fold. These days, that is the most common site. Another may be fold of the groin, another may be rectum, and another area may be oral cavity. Okay, so let me repeat again. The first is a axillary fold or axilla. We have to keep thermometer for at least 3 minutes there. And these days, there are some special thermometer which produces a sound when the particular time is over, isn't it? Like a beep. Then you can measure the temperature. That's quite easy. And these days, some really good type of thermometers are also available, like electronic thermometer. You just expose that thermometer in front of the patient on the skin surface and the temperature will be given. So different types are there. But we don't like to put thermometer inside the oral cavity in a child. Why is that? Anybody? Why I don't want to put thermometer inside the oral cavity in a child? What's the danger?
Because it may burst or mercury can come
Because
out
he
into the
can
mouth.
bite it,
He
or
can
there is
bite
maybe
it.
risk of any injury.
Exactly. You're absolutely correct. We cannot trust the child. The child may bite the thermometer. The child may bite the thermometer, and thermometer has mercury. And mercury is a type of poison. Okay, it's a poisonous substance. So the child may swallow it after that. So to avoid all these situations, okay, don't put thermometer inside the mouth of a child to measure the temperature. In a bigger child, after 10 to 12 years of age, it's fine. We can trust that child, but not before that. Much safer is axilla. That is one point. And second, the thermometer is a dirty instrument, isn't it? You have used that in so many different patients. If it is not cleaned properly, then don't put that inside the mouth. Okay, so many patients, they don't even want to put it inside the mouth. So because of this reason, axillary temperature is the best one. Let's move on. Now, another important examination or general examination we need to do is a pulse rate or the heart rate. Now there is one important point here. With every degree Fahrenheit rise in temperature, okay, with every degree Fahrenheit rise in the fever, pulse rate goes up by 10 beats per minute. You should never forget it. Now let me explain why this is so important point. A child was brought to the hospital with a fever of 38 degree centigrade or just 100.4 degree Fahrenheit. Okay, 100.4 degree Fahrenheit. But that child is having pulse rate of 120 per minute. Okay, the child was already 10-year-old. It doesn't match. The fever of just 100.4 degree Fahrenheit cannot produce pulse rate of 120 per minute. So something else must be there. So this type of information we get, okay, by knowing this point. So what else can be there? Probably the child is having some other heart disease, and because of the heart disease, there is tachycardia. The child may be having hypovolemic condition. Because of that, there may be tachycardia, isn't it? The child may be having some other illness in the body. Because of that, there is already tachycardia. So this is the way you need to think. So here, disproportionate increase in the pulse rate may suggest early sepsis or primary cardiac disease. Means it's not matching. The temperature is just rising and pulse rate is already very high. It's not matching with each other. That is called disproportionate increase in the pulse rate. It may suggest something else. Let's move on. Another is respiratory rate. The normal ratio of pulse and respiration in health is 2 to 4 to 1. 2 to 4 to 1. What does that mean? So let's talk about it. If a child is having respiratory rate, okay, of 30, pulse rate is around double, okay, to 4 times than that. It depends on the age, okay. It depends on the age. It's the average one, right? So if the pulse rate is 90 and respiration is 30, it's acceptable range, like that. Let's talk about in adult. What is our pulse rate? What is the average pulse rate in adult? Yes, in adult.
60 to 100 beats per minute.
100 beats per minute, sir.
Okay, 60 to 100 beats per minute. You're right. But average, I'm asking the average. That is a range, isn't it? So what is the average one? Let's say
72.
72 beats per minute.
72 beats per minute.
70.
exactly. You're right. 70 to 80 or 72. Let's say it's 72. And what is the normal respiratory rate in adult? What is the normal respiratory rate? 18 to 20. Now see this, take the ratio. If it is 18, it is 4 times, pulse is 4 times than respiration. So this is one of the good way to remember. It is 2 to 4 to 1. Okay. Now let's come to the point. The ratio is increased in primary cardiac disease and decrease in respiratory pathology. That means the pulse rate is high in heart diseases and respiratory rate is high in respiratory pathology. So the ratio will change accordingly. Now, what are the other general examination finding or examination we need to do? Check for the state of hydration, or in other words, check for dehydration, whether the child is dehydrated or not. I have taken a class regarding dehydration and many students know this already. So there are so many important signs of dehydration, okay? You check from head to toe, like sunken anterior fontanelle if a child is less than 18 months of age. Lack of tear, lack of saliva, reduced skin turgor, okay? Low volume pulse, very cold and clammy periphery, prolonged capillary refill time, decreased urine output, and decreased blood pressure. All these are different features of dehydration. You check for that, whether it is present or not. Examine for peripheral perfusion. Now, peripheral perfusion is a part of this dehydration sign checking itself. Peripheral perfusion means, what about the capillary refill time? It should be less than 2 seconds in a normal child. If it is prolonged than 2 seconds, it is abnormal. How warm are the periphery? You check for that. Okay, this is called peripheral perfusion. Check for the skin rashes, whether they are present or not. Remember, in the last class we talked about fever with rashes, and there are different examples. So if I quickly want to take the name once again, they are chickenpox, rubella, measles, infectious mononucleosis, exanthema subitum, erythema infectiosum, meningococcemia, okay, even scarlet fever. So many different examples are there which may present with fever with rashes. But one of the important condition I like to highlight here once again is meningococcemia. Never forget this. And that meningococcemia will present fever with petechial rash. And this is a life-threatening condition because within 24 hours, the child will collapse if we fail to diagnose. Examine for lymphadenopathy. What do you mean by lymphadenopathy?
Stool and enlargement.
Enlargement of the
The
Enlargement
enlargement
of
of
lymph
lymph
node.
nodes.
Exactly, very easy meaning. Enlargement of the lymph node or swollen lymph node is called lymphadenopathy. Excellent. Now, these lymph nodes are sometimes painful and sometimes painless. If it is caused by bacterial or viral infection, there is more chances of painful lymphadenopathy. Okay. If it is caused by tuberculosis, then it is usually painless. If it is caused by malignancy, it is also painless in the beginning. Malignancy can also lead to fever. We already know that, like leukemia, fever is quite common there. Don't forget to check for ENT examination. Now, ENT means ear, nose, and throat. Ear, nose, and throat. In a child, this is a very common site for infection. Ear, otitis media is so common in a child. Nose, okay, in a bigger child, sinusitis may occur, but in a smaller child, the sinuses are not yet developed, so sinusitis is not a common feature. Okay, but runny nose is very, very common in them. Signs of upper respiratory tract infection can be detected by nasal examination. And throat examination is so necessary just to rule out pharyngitis and tonsillitis, very common in a child. Okay, so it is often forgotten or often neglected part of the exam, but you should not do that. And the last one is ophthalmic examination, especially in case of pyrexia of unknown origin. Please mute yourself. Okay, ophthalmic examination is done in case of pyrexia of unknown origin or fever of unknown origin. FUO is fever of unknown origin. Even with extensive investigation, either as an outpatient, uh, uh, form or inpatient form, you have not yet reached to the diagnosis. This is called fever of unknown origin, and some of the clues may be got from ophthalmic examination, means eye examination. One important example I like to highlight here, in cytomegalovirus inclusion disease, there is chorioretinitis. Chorioretinitis. These are the different layers of the eyeball. So they are involved there, and we can get this information by examining the eye. Okay, let's move on. Now, after doing all the general type of examination, let's do the systemic examination now. Which systems are affected? We need to specifically examine for them, like respiratory system examination, central nervous system examination, cardiovascular system examination, and examination of the abdomen as a part of GI system exam. Now, you may be wondering, how can I examine so many systems together in a child? Okay, so the proper answer here is, you can get certain clue from your history taking and physical examination. So you do that systems first, and if you believe some other systems may be also affected, you go for the examination of that system later on. This is the way. Okay, do not deviate from the main thing here. For example, if the child is having pneumonia, don't spend a lot of time by examining the central nervous system. That is useless thing to do. So examine the respiratory system first. And if you believe CNS is also affected, go for the examination. That's the meaning. Now please focus here. In respiratory system, there may be flaring of alienagy, also known as nasal flaring. Alienagy is a name of a muscle which is present there. Working of accessory muscles of respiration like sternocleidomastoid, like trapezius, like intercostals and subcostals, or anterabdominal wall muscle. It indicates pneumonia. Pneumonia or lower respiratory tract infection. Now, we all know the meaning of pneumonia. Pneumonia is involvement of lung parenchyma. It's inflammation or infection of lung parenchyma with consolidation. That is pneumonia, usually caused by microbial pathogens. Examine for central nervous system. Detailed mental status examination needed to diagnose CNS infection. If there are signs of meningism present, okay, like a bulging fontanelle, stiff neck, Kernig sign, Brudzinski sign, etc., then we strongly believe this child may be having meningitis or meningoencephalitis. Meningism is the signs of meningeal irritation. Examine cardiovascular system in detail. What is the first heart sound? What is the second heart sound? Is there any third or fourth heart sound present or not? What about the murmur? Okay, so all these things we need to note. And examine the abdomen. Inspection, palpation, percussion, and auscultation. So all these examination are, itself are a big classes. So we cannot cover all of them here right now, but just remember these are the important system we should examine. And regarding the respiratory system also, examination of the chest has to be done properly, right? Inspection of the chest, palpation of the chest, percussion of the chest, and auscultation of the chest has to be done. In a child, auscultation is always done in the beginning rather than other type of examination. So this is how systemic examination is done if a child presents with fever. Now we are talking about how to do physical examination in a child with fever. We have done that, taken the history and did physical examination as well. At the end, see this, good clinical history and thorough physical examination forms the first step in the management of fever in children. Very, very important point. We should not ignore the importance of these two things. Never only give weight to the investigation. That's what a young doctor would think, isn't it? Or the medical student think. When they go to the hospital, they think investigation is the most important part. It is not. The important part is history taking and physical examination, followed by some relevant investigation. Now, what are those relevant investigation we need to order? See here. So please focus here now. There are some general investigation and there are some specific investigation. General is done in most of the cases of fever, in most of the cases, okay, like complete blood count and blood culture, very routinely done in a child. Complete blood count means hemoglobin, hematocrit, total leukocyte count, differential leukocyte count, and the platelet. This is called CBC. So hemoglobin, hematocrit, TLC, DLC, and the platelet count. This is called CBC. Absolutely necessary. And there are so many things we can discuss here. If there is high WBC count with neutrophilia, means the percentage of neutrophil is more than 80%, this is a clear-cut evidence of bacterial infection or pyogenic type of infection. If the total count may be slightly elevated or normal with differential count shows lymphocytosis, this is an evidence of viral infection. Viral infection leads to lymphocytosis. If total leukocyte count is normal or slightly elevated and eosinophilia is present, that means this may be a case of parasitic infection or allergic diseases. So these are the important points in CBC. Now, what is the importance of blood culture? Anybody? Why you go for blood culture?
To know the presence of any bacteria or any parasites are mainly.
Okay, very easy question and a good answer. Especially we want to know which bacteria is involved. Okay, so blood culture is mainly done for bacterial pathogen. Now usually the disease is associated with bacteremia and septicemia. The same organism may be present in the blood. So if we take the blood out, please mute yourself. If we take that blood out and then send to the lab, they will culture it, and after 72 hours there may be growth of the bacteria, and after that they will go for sensitivity test. This is known as antibiotic sensitivity test, and we exactly know which organism is grown and which antibiotics are used for that particular organism. This is the importance of blood culture as well as sensitivity test. Very, very important part of the investigation. Never forget it. Okay, so let me underline it. Peripheral blood smear is another, general type of test we do. Peripheral blood smear is all about, okay, the differential leukocyte count, how the platelets are seen there. Okay, are they big, are they small, what is the morphology of the RBC, everything can be detected by peripheral blood smear. Even malarial parasite can be detected on this. Urine routine examination and culture, very routinely done in a child with fever, because who knows, urinary tract infection may be the cause of fever. So until and unless we go for this test, we don't know whether UTI is there or not. Now let me ask you one question: which type of UTI causes fever? Which UTI? Which UTI? There are two types of UTI, right? Upper and lower. So which one causes fever?
Lower UTI, sir.
The lower UTI.
Lower UTI doesn't cause fever. Okay, so maybe probably you have forgotten. So let me highlight that once again. Urinary tract infection is divided into two types: upper and lower. Upper means pyelonephritis is the upper. Lower is cystitis and urethritis. Cystitis and urethritis doesn't usually lead to fever. Pyelonephritis usually causes fever with chills and rigor, and that's a serious illness. So don't forget that. So we need to go for urine routine examination and culture and sensitivity test. Now, CSF analysis and culture is done if you suspect meningitis. Okay, if you suspect meningitis, not routinely done in every child with fever, but when we suspect meningitis, okay, please pay attention here. If a child comes with relatively high grade fever with headache, vomiting, seizure, and loss of consciousness, we strongly suspect meningitis. And during this type of children, okay, or in this type of children, we'll go for lumbar puncture and CSF analysis. Now CSF analysis means we take a sample of the CSF and send that for protein. Okay, send that for protein, send that for sugar, what is the total amount of sugar or glucose, send that for total WBC count with differential. With differential means what type of WBC are there, what's the count of RBC there. Okay, so all these are called CSF analysis, and they provide a lot of important information to us. At the same time, don't forget to send for culture and sensitivity test of CSF. Okay, so let's move on. See there. Chest X-ray is a very important investigation. It's a general one. Chest X-ray is done if you suspect respiratory system is involved, or even cardiovascular system is involved. We can go for chest X-ray. And sometimes what happens, the child simply presents with fever. We don't know what is the cause of fever. So during that time, sepsis workup is done, and chest X-ray is a part of sepsis workup. So it is very, very routinely done in a case with fever. Stool routine microscopic examination. Routine microscopic examination can be done if you think GI infection is the cause of fever. Like if a child presents with diarrhea or dysentery, then stool routine examination can be done. So these are some of the important points. So please mute yourself. Okay. Now, apart from them, what are the specific investigation now? Mantoux test. Now, Mantoux test is done for which disease?
Tuberculosis.
Tuberculosis.
Very good. Very good. Every student know that it is done for tuberculosis. Very good. It is very routinely done in a child if you suspect tubercular infection. Aspiration and biopsy are mainly done from lymph node, like fine needle aspiration and lymph node biopsy, specifically again to find out different type of chronic infection here. TB is again a good example I can give. Aspiration of pleural fluid can be done to rule out pleural tuberculosis. Aspiration of pericardial fluid can be done if you suspect pericarditis is there. Aspiration of ascitic fluid can be done. Okay, so there are different examples. Seroimmunological test means antibody test, and antibodies are formed against different infection. So we can utilize this principle for the detection of or diagnosis of infection, isn't it? Even these days for the coronavirus, okay, the COVID-19 infection or disease, we can go for antibody testing, but antibody testing is not that reliable for the diagnosis of COVID-19. We mainly go for PCR, but nevertheless we can do that. And see there, another is PCR, polymerase chain reaction, very commonly done in case of viral infection, but in some rare type of bacterial infection also we can go for that. Some radiological tests like USG, CT scan and MRI and echocardiography can be done according to the situation. That's why they are called specific tests. Remember, we don't go for these tests in every patient who present with fever. Ultrasound is mainly done for abdominal infection, very commonly done. CT and MRI, okay, mainly for the central nervous system infection or even for the abdomen, it depends. And echocardiography is done for the heart condition. Endoscopy is another important specific test we can go for according to the situation, mainly done for GI infection and urinary infection. Okay, let's move on. Now, at the end, let's talk about how we treat a case of fever. So please pay attention. This is a very important class for you. This is a purely a practical type of discussion we are doing, because even right now you are not a doctor, but your family member thinks you are already a doctor. You have so much knowledge. So if something happens in your family or in the neighborhood, they will simply ask you. For example, if a child has fever, they can ask you, how to treat that fever, what medicine we give. So this is a very important topic, and you will get exact information if you pay attention here. Regarding the general treatment, identify and treat the underlying cause. This is the mainstay of treatment of fever. I already discussed this so many times. Fever is not a diagnosis. Fever is a symptom or sign. And there has to be some disease which caused the fever or some infection which caused the fever. We try to identify that. Antipyretics are used to decrease the temperature. So this is a symptomatic treatment. Okay, this is symptomatic treatment. They lower the central set point in hypothalamus, and that's how they decrease the body temperature. And this is the mechanism. They inhibit cyclooxygenase enzyme, and by doing that, they prevent the synthesis of prostaglandins. Okay, they decrease the synthesis of prostaglandin. And if you remember the pathogenesis of fever, prostaglandin is one of the important chemical mediator which is involved there, which is raising the thermostat. So if we prevent the synthesis of prostaglandin itself, the thermostat set point is lowered, which leads to decrease in body temperature. This is the mechanism of action. And which drug I'm talking about here now? Which are those drugs? Yes?
So they experience the non-steroidal anti-inflammatory.
Exactly.
NSAID.
Exactly. Very good. So I'm talking about paracetamol and NSAID drug. Paracetamol or acetaminophen and NSAID, non-steroidal anti-inflammatory drug. Antipyretics do not interfere with immune response to infection. Okay, so they are considered relatively safe. Do not give any steroid. Steroid can also decrease the temperature, but use of steroid just like that, okay, is very, very harmful for the child or for the patient. And so many of the people, especially towards the remote area or towards the village side, okay, they are not the proper doctor, but they think they are the greatest of the doctors, isn't it? So what they do, if somebody come to them with fever, they give steroid. Now what happens? Steroid will definitely decrease the temperature, and at the same time it will control the inflammation also. So patient feels, all right during that time. Patient feels, yes, there is no fever, I'm feeling all right. Wow, this is a good doctor. Patient thinks like that, but actually what is happening, it is just suppressing the signs of inflammation. Within few days the inflammation will come back, the features will come back, the infection is spreads inside the body, and patient will be more sicker. So do not give corticosteroid in a case of infection until and unless you diagnose it. Now, what are the drugs we give to control the temperature? Acetaminophen and ibuprofen are the two most commonly used drugs to decrease the temperature in a child. Never forget them. Acetaminophen means paracetamol, which is the most commonly used drug. And one more option you have is ibuprofen. So this is the dose, 10 to 15 milligram per kg every 4 to 6 hourly. And ibuprofen, just 10 milligram per kg would be enough. We give it also 6 to 8 hourly. Okay, so these are the doses. Now, another important general treatment we need to do in a case of fever is maintain hydration, because the child may lose a lot of fluid from the body if there is a prolonged rise in temperature. So adequate hydration is maintained. And look at this statement here. The fluid requirement increases by 10% for every 1 degree centigrade rise in temperature above the baseline. What does that mean? The fluid is lost from the body. So if we do not give enough fluid, the child may be dehydrated and temperature cannot be lowered down. So adequate hydration is maintained. At the same time, do not overhydrate the child, and that overhydration may cause dilutional hyponatremia. So we should be careful. And overhydration can sometimes lead to pulmonary edema also. Comfortable surroundings are maintained. So what does that mean? Open the windows and doors. Allow that cool air to come inside. Allow the fresh air to circulate inside the room. And many people have got, another type of thinking. Okay, if the cold air comes inside the room, the child may get more sicker. That is not a good type of thinking here. Okay, we should allow the fresh air to come inside the room. So proper ventilation is necessary. Do not bundle the child in extra clothing or blanket. And that is another mistake done by the parents. So if their child is having fever, they give extra cloth to the child. They put the child in the bed and then cover the child with a lot of blankets. That is not a good thing to do. The child is having increased temperature inside. Okay, so we should remove the extra cloth. Actually, you should not give excessive blanket there. Just one layer of thin cloth may be enough. Another important practical information is sponge the child with tepid water. Now, what do we mean by that? Tepid water means the water which is at a room temperature. Okay, that water is a very clean towel, okay, or a handkerchief or whatever is soaked with that room temperature water, and we put that towel on the forehead of the child, or we rub the whole body of the child with that towel. This is called tepid sponging. This is very soothing for the child, and it can decrease the temperature also. But one important point we should avoid is ice bathing. Ice bath should never be done. It should be avoided, because this ice is a very cold temperature, and cold temperature will cause vasoconstriction. When there are vasoconstriction going on, the child cannot lose heat from the body, so it will further increase the core temperature. So never forget this. Okay, so That's why we do not, tepid sponge with ice cold water or give ice bath to the child who is having fever. Even for the adult, it is the same thing. Is it clear?
Yes, sir.
Yes, sir.
Okay, let's move on. Now, after doing this general type of discussion, let's talk about the specific treatment, that is antibiotic. Now, which antibiotics we give if infant or neonate, okay, gets this type of bacterial infection. So infant up to 28 days are called neonate, okay. So you can clearly write neonate here. So which are the antibiotic choices if neonate gets infection or the fever? Now see that one of the choice has to be ampicillin. This ampicillin is given to cover Listeria. Listeria monocytogenes is covered by ampicillin. So never forget this. Listeria is one of the common pathogen in neonatal age. So we have to use ampicillin, and along with that we can go for, okay, see this, gentamicin or third generation cephalosporin like cefotaxime. Cefotaxime is better in case of neonate rather than ceftriaxone. So ampicillin plus cefotaxime or ampicillin plus gentamicin. So this is a good combination. Consider adding vancomycin if you believe the infection is caused by Staphylococcus aureus or penicillin resistant case of Streptococcus pneumoniae. So resistance type of gram positive organisms are treated by vancomycin, but that is added only if you think those type of organisms may be there. Okay, so let me repeat: ampicillin plus cefotaxime and ampicillin plus gentamicin. This is a good combination. Now, one important information: what are the common pathogen they can cause infection in the neonate apart from Listeria? Which are the others? And they are GBS. What's the full form of GBS? Anybody? Which bacteria is GBS? What is the full form? Anyone? Group B streptococci. Exactly. Group B streptococci, okay, also known as streptococci agalactiae. Streptococci agalactiae. Okay, this is another name. Group B streptococci or Streptococcus agalactiae. Very common pathogen in case of neonate infection. Another is E. coli, and third is Listeria. Let me write Listeria here also. So see there. Apart from them, Staph aureus can be there. Staph aureus, okay, and some other gram negatives may also be there. But don't forget this name. Now, Listeria is covered by ampicillin. We already know. So rest of the organisms are covered by third generation cephalosporin or gentamicin. And if you believe Staph aureus is there, you need to go for vancomycin. Now, infants from 28 to 90 days, these are the common bacterial pathogen which can lead to infection, like streptopneumoniae or pneumococci, group B streptococci again, Staph aureus, Neisseria meningitidis or meningococci we should say, Haemophilus influenza or HIB, and Listeria monocytogenes. So some organisms are added there. Okay, so which antibiotic we use for the treatment? Which antibiotics? You can give that answer right now. If you suspect Listeria, again strongly suspect Listeria, you have to use ampicillin. There's no other way. And all other organisms are covered by third generation cephalosporin like cefotaxime. And Staph aureus, if you strongly believe, you have to go for vancomycin. So similar type of antibiotics. Now see this? Exactly same. There's no difference at all. So this is our antibiotic choices in infant from 28 to 90 days. Now, after 3 months, up to 36 months or 3 years, these are the common bacterial pathogens: Streptoneumoniae, Neisseria meningitidis, Salmonella typhi, and Haemophilus influenza. So only one antibiotics will cover all of them for this age group, that is third generation cephalosporin. Why I am not using ampicillin now? Where is ampicillin here?
Because there is no listeria.
No Listeria monocytogenes.
Excellent. Excellent answer, because there is no Listeria monocytogen. That's why no ampicillin. And all of these organisms are covered by third generation cephalosporin. Now we can safely use ceftriaxone in this age group, or you can go for cefotaxime as well, any one of them. Now some more practical informations regarding the treatment. If the response to the first antibiotic is poor, now what are you going to do? Isn't it? This is a important practical problem now. You used the one antibiotic, the first one, and the response is poor. After that, another drug may be tried. But how long time we should give to that first antibiotic to see the response? And the answer is 48 to 72 hours. Not before that. Not after 1 dose or 2 doses, We have to give certain duration for that antibiotic to work. After 2 to 3 days, still if there is no improvement in the child, then another drug may be tried. If 2 drugs have failed, then reconsider the diagnosis. Who knows, your diagnosis may be wrong. You may be, thinking in some other direction. Okay? Do not try empirical treatment for tuberculosis except in life-threatening situation. Now, what is empirical treatment? What is empirical therapy? Anyone?
Sir, it's a therapy used
Just by
We
increasing
don't
doses.
without knowing the main
It will
pathogen.
cut
We use treatment.
antibiotic.
Okay. Now, empirical means till now, you really do not know what is the exact pathogen, but you almost know from your clinical expertise that this pathogen may be causing the disease, and that this thing is helped by the the different researches done by that hospital, different researches done by the lab, which type of organisms are present in that community or society. So accordingly we judge for the antibiotics. This is called empirical therapy. In tuberculosis, do not simply use empirical anti-tubercular drug until and unless you confirm, yes, this is a case of TB. There are 2 reasons for that. One, in tuberculosis, we need to give medicine for a long time, at least 6 months. Remember that 6-month treatment is not a joke. It is not for a few days, So this is one problem. And another one, if we use anti-tubercular drug just like that, there is a high chance of resistance organism which will emerge. This is called multi-drug resistant tuberculosis, and this is a killer problem. So do not try empirical therapy in case of TB. Steroids should never be used for undiagnosed fever. Already talked about this. Okay, so let's conclude this big topic, but very important one. Appropriate management of fever in infant and children is essential to minimize the risk of serious bacterial infection. In case of very small babies, every fever, okay, is considered as serious bacterial infection until proven otherwise. So what does that mean? Okay, slight rise in body temperature in a neonate or an infant is considered a bacterial infection, means I need to consult my pediatrician. The pediatrician should examine the child properly, and some good investigations have to be done to rule out whether there is bacterial infection or not. Then only you should be satisfied. Physicians may individualize the therapy based on clinical circumstances. Absolutely. One pediatrician may treat the fever a bit differently than the other. Some pediatrician, they don't want to start any antibiotics. They just want to confirm it first, and then only antibiotics are started. Some other pediatricians, they want to start antibiotic from very beginning, okay, and their reason is they already know that this is a case of bacterial infection. So this is a individual variation, but we must form one guideline, isn't it? Otherwise the therapy would be very haphazard. So this is all about the approach to a child with fever.